Hi, I'm Nicole DeVita, and I'm the president of the Vermont Federation of Nurses and Health Professionals. This year, 2 unions at UVM Medical Center, the support staff and technical professionals, have decided to bargain our contracts together as 3,300 employees because we know we're stronger together and the challenges we're up against in our state are bigger than ever. Our employer, UVM Medical Center, is one of the largest employers in the state of Vermont. They have enormous power in shaping not just our healthcare system, but our entire state economy. To put it simply, we think they could and should be doing better. There is an affordability crisis in Vermont. Our members are struggling to buy groceries, pay rent, and access their own health care. Vermont is one of the most expensive places to receive health care in the world. But that money doesn't make it to us as healthcare workers or even translate to quality patient care. Instead, hundreds of millions of dollars each year are diverted from our local hospitals to UVM Health executive salaries, propping up less profitable hospitals in New York and paying for public relation campaigns. The money that we, as healthcare professionals, generate by caring for patients goes to a network that isn't taking care of us in return. It's time for the medical center to be a real leader on the issues we care about. That's why this year we've developed a common good bargaining platform. Thousands of our members have already signed on to support proposals that affirm healthcare is a human right, safe staffing saves lives, everyone deserves a livable wage, immigrant rights are worker rights, and we are stronger together. Today, we'll be introducing articles related to the immigrant rights and livable wages portion of our platform. And I'll turn it over to my colleague, Jacob, to discuss some exciting partnerships that are developing out of this work.
Thanks, Nicole. My name is Jacob Berkowitz. I am the president of UVM Medical Center Support Staff United. And our union is one of the most diverse workforces in the state of Vermont. We have many members who are immigrants and feel a lot of fear navigating this new era of immigration enforcement. Today, our unions are presenting 2 sets of proposals regarding immigration that we think are essential for making our hospitals and communities safe for everyone who wants to call Vermont home. First, we'll be presenting a set of proposals that have been developed in collaboration with the residents' union, CIR, and Migrant Justice that prohibit ICE from entering hospital facilities and create additional protections for employees navigating immigration proceedings. We think that this is essential for creating a safe work environment, and I'm going to invite one of my union's members, Stephen Tendo, to share his story now.
Good afternoon. My name is Stephen, and I am a healthcare worker in Vermont, working with UVMMC. I am speaking today because what happened to me is not just a personal story. It's a workplace issue, a community issue, and a human dignity issue. Over the past year, my immigration requirements repeatedly collided with my work schedule. Mandatory ICE check-in and appointments fell during shifts, forcing me to use my own CTO just to comply with federal requirements. No work should have to choose between keeping their job and following the law. Earlier this year, while leaving my second job at a nursing home, I was taken into custody of ICE without warning. I spent 16 days detained, struggling to access medications and nutrition I need most to manage my diabetes. Those 16 days had lasting effect on my health, my finances, and my ability to work. When I returned home, my health insurance that I get from UVMMC was interrupted because I had run out of my work visa. The medications that keep me alive suddenly cost hundreds of dollars out of pocket. That include Ozempic and metformin. I was trying to recover physically and emotionally while still showing up for my patients and coworkers. I am sharing this story today because I am not the only worker facing these challenges. Many immigrants who come to Vermont to care for this community are navigating systems that are unpredictable, intimidating, and often dangerous to their health and stability. What I am asking for is very simple, that employers, just like UVMMC, do everything they can to support workers who face immigration-related barriers, including paid time for mandatory appointments, extended leave when emergencies happen, and commitment to keep ICE out of healthcare facilities. These are places of healing. They are not places of fear. I love my work. I am at the top of my class in the nursing school because I take my calling seriously. I want to continue serving this community, and I want every worker, immigrant or not, to feel safe enough to do the same. Thank you for listening, and thank you for standing with all workers who deserve dignity, safety, and respect. Thank you.
Thank you, Stephen. I'll also highlight that our union worked very closely with Migrant Justice in getting the organizing plan to get Stephen home during those few weeks where he was in ICE detention. They were essential. Their expertise was essential in assisting us in getting Stephen home, and we're so glad that we continue to work with them to protect not just our members but our community. Which connects to our second proposal that we're going to be bringing to the table today in bargaining. We are going to be introducing an article which would facilitate a partnership between UVMMC and Migrant Justice to bring the hospital into the Milk with Dignity program. This program, which is unique to the dairy industry, creates fair labor standards for workers who otherwise have no right to unionize or protections for workplace safety or minimum wage. We are a diverse community at work and at home, and we have a unique opportunity with the Milk with Dignity program to value the wider system of labor that makes our hospital run each day. I will now turn it to Migrant Justice to discuss the program.
Hola, mi nombre es Emilio, un ex trabajador de una granja lechera.
Hello, my name is Emilio. I'm a former dairy worker.
Hoy quiero empezar agradeciendo por esta solidaridad que estamos tomando todos los trabajadores que estamos en contra de las injusticias y donde luchamos en lugares donde no hay dignidad.
So I want to recognize the solidarity that's coming from the workers at UVM Medical Center, standing with other workers who are also fighting back against indignity in the workplace.
Para dar un contexto, yo era un trabajador en una granja lechera donde tengo la experiencia, donde las cosas que he vivido no son fáciles, que también no recomendaría a nadie porque las cosas que yo viví fueron muy difíciles.
As a dairy worker, I experienced things that I wouldn't wish on anybody. I had very difficult living and working conditions that I had to suffer through and that I wouldn't ask anybody else to do.
Pero hoy en día tenemos un programa de leche con dignidad que ha cambiado vidas, que ha resuelto problemas, que hemos tenido la solución para grandes injusticias y cosas que no le deseamos a nadie.
And because of that, we have created the Milk with Dignity program, which is transforming the industry and bringing about change so that those conditions are no longer a reality in this industry.
El hecho de que estamos todos acá, estamos luchando contra las injusticias, sin importar el estatus migratorios, porque un trabajador merece tener dignidad y respeto.
We are all here fighting with one voice, because regardless of your immigration status, all workers deserve dignity and respect.
Y hoy en día estamos agradecidos por esa solidaridad, que sería bonito tener leche con dignidad no solamente en las granjas, también en las industrias como en los hospitales, universidades.
And so we are grateful for the solidarity from the hospital workers to bring Milk with Dignity into the hospital, into UVM Medical Center.
Queremos expandir todo esto para que donde haya leche con dignidad haya respeto para todos los trabajadores.
And when Milk with Dignity is on every farm, that means all workers on dairy farms will be treated with the respect they deserve.
Gracias.
Thank you.
So thank you everyone for attending and taking the time to listen. We look forward to presenting our proposals very shortly to UVM Medical Center, and we also look forward to our community supporting our Bargaining for the Common Good platform. Thank you very much.